We live in times where we have better healthcare than ever before in history, and still we have a mental health crisis. Of course, there's not much data to compare, and back in the times we already had mental health crisis and problems. Let's just remember the wars, but no one really cared about it that much. But nowadays we put more focus on mental health, and therefore we see that we are currently in a mental health crisis once again. Because as of September of 2025, more than 1 billion people do have problems with mental health or certain disorders. So for example, 4.4 of these 1 billion have anxiety, or 4% do have depression, 0.5% do have bipolar disorder. And the problem is we do have this insane healthcare system and healthcare nearly everywhere in the world, but still there are many countries where it's not looked at or simply not cared about. I want to take a look at the cause. So with COVID-19 in 2020, we had these major lockdowns, and through those lockdowns we had, of course, isolation. Isolation can come with a lot of depression, especially when you don't have these social contacts anymore, and as well with anxiety, because suddenly the whole world was locked down and so many things changed, and a world that quickly evolves, that changes so fast, can be very scary, to be honest. And with 2020 we saw an increase in anxiety of 25%, but also an increase of depression. Further causes of these disorders, of these mental health problems, of course, poverty. After the economic crisis that we had in the COVID times, but also after this, many people lost their jobs, and there we also have the unemployment rate that suddenly went up. And these two causes affect, of course, more vulnerable populations, those that really require the job. I mean, nearly everybody requires their job, but some people have more savings than the others and have more opportunities to look for a better job. And this, of course, really messes up your mental health when you don't have this baseline of living, the job that gets you income every month. With the rise of social media, we also saw another problem. So many trends. Take a look at beauty ideals, at how a person must look, how a person must behave. And this is, especially for younger generations, such social pressure. And this digital pressure is also linked to youth well-being, and especially declining youth well-being. Because, for example, also take a look at the adultification on TikTok, where young girls need to look like grown-ups and behave like grown-up women in order to, of course, they gain likes, they gain clicks and whatsoever, but the price you need to pay is higher than the actual outcome, the reward you receive. If you also take another look at the low-income housing, then we see that families broke apart, or sometimes just the situation in the family gets a bit messy, so to say. And then we also have mental health problems in the children, but also the parents. Generally, we can say that the crisis, the mental health crisis, is more problematic in the low income or middle class income countries, for example, some Asian countries or African countries. But the thing is, those countries don't really, like for example, those in Africa, they either have very, very good mental health because they don't have this living standard that we have based our identity upon, like the Western standard where you need the certain car or the certain house. They are way happier with less, or they have generally no time to consider their mental health as they need to actually survive. I want to take a look at the impacts, and this shocked me. The suicide rate of every year, so I take a look at 2021, for example, the suicide rate is being estimated at 721,000 people every day, which is nearly 1 million people every day that are suicidal or at risk. The impact of these mental health problems in the youth is, for example, coping. You cope, for example, through abusing substances, or you watch streams a lot, YouTube a lot, you might get addicted to gambling, or you watch pornography all the time. It does not only affect you in this sense, it also affects your general well-being, your general health, and of course your learning capabilities that decrease with mental health problems. When you take a look at this on a broader perspective, then we see that the whole workforce is being impacted and society in its whole, because the health costs go up and the economy doesn't have as much workforce. But I must say that, is this really this big of a problem? I mean, shouldn't we look at the individual, help them, instead of telling them, fix your mental health problems, you need to get to work? I don't really think that this is the point where we should stand. I mean, it's 2025 now. When we take a look at the age groups, then we see on the younger side, 10 to 19, every 1 in 7 children has mental health problems. Then in the young adults, 18 to 25, there we see the highest rates of more severe mental health problems or serious mental illness at 11.6%. When we see children from 3 to 17, then we have 11% that have anxiety and 8% that have depression, which could also be linked to the screen time and, for example, also brain rot, which I'm going to link you a video from me that covers this theme more explicitly. But generally, since the mid-1990s, we can see an uprising of depression up to 119% and anxiety upwards to 164% in the youth, which is also exacerbated by social media and screen time. For females, we more have internalizing disorders. As for men, we have more externalizing disorders such as ADHD. And now, to sum this all up, we can see that our mental health is of course very needed for our general well-being. And if our mental health is not good, we as a person also do not feel well. We should more take a look at the individual people, help them in order to have a better society, instead of always just looking at us or looking at some numbers like the economic workforce. Doesn't really matter. We only live once, and there we should help others instead of helping some numbers grow. If you enjoyed this video, please consider leaving a like and subscribe. Check out my Patreon where you find more information, and then see you in the next one.